Hi everyone, thank you for joining us again. So today I'm here with Maddie, also known as Miss Aesthetic. How are you?
I'm good, how are you?
Yeah, good, thank you. Would you like to kind of just have a little bit of chat about who you are, what you do, and how you got into what you do?
Sure. So I have been a registered nurse for just coming up to 10 years, been nursing for longer than that. Started in the operating theatre. So I do anaesthetics, also do ICU and recovery. So I do a lot of like reconstructive surgeries, like big breast flaps and like facial reconstructions, those types of things. So moving to aesthetics was a pretty natural move for me. And yeah, I just really enjoy it. Like I still work in hospitals and I will always work in hospitals. I really love it. But it's the pretty fun side of nursing.
Yeah.
So yeah, and you know, there's smallest little things can do so much for people, which I quite like. So
yeah,
it's very different type of nursing, but it's also quite technical. You need to have an eye for it. So yeah, it's been a really good move.
So did you want to tell us a little bit about the treatments that you do?
Sure. So I do mainly injectables, so your anti-wrinkle and your fillers. But I also like to focus on like medical grade skin health. So whether that be medical grade needling, PRP, like the AquaGold, you know, Botox facial as such. What else do I do? I am starting to do PDO threads, which is exciting. Yeah. So it's skin tightening. So it's like a biostimulant. So it's similar to skin needling, where it's a collagen induction therapy, but you can use it in places where it's harder to get the needling pen into, say like tear troughs or you know, between the breasts or anywhere that you've got wrinkles. Yeah, you can pop these little threads into to stimulate collagen and really thicken the skin, which is nice. So yeah, there's a few up and coming things, that and the plasma pen. So
that sounds amazing.
Yeah, but just more focusing on skin health as the foundation. You need to have a good foundation prior to any injectables. Like injectables are fantastic and they definitely have their place, but you need to have good skin to start off with. Otherwise, you know, you're kind of investing your money in the wrong thing initially. So
with you know, your home care, like what you're using on your skin, how does that work in conjunction with the treatments that you do?
So some treatments, say peels, needling, look, it really depends on the person's skin, but most treatments I'll try to incorporate like pre and post home care. So eye stock, aspect doctor, mind you, any medical grade cosmeceutical is fine, being that it's been prescribed specifically for your skin type, because it's not a one size fits all, unfortunately. It'd be great if it was, but it's not. So yeah, I try and get all my clients on products beforehand, so your skin's in optimal health. We do the treatment and then I'll give you products for home care.
How long, you know, before you get your treatment, would you recommend that someone starts building that good foundation? I know it's...
ideally ASAP. Yeah. It just depends on the treatment. So say a peel, I want you to be prepped on particular products for at least 2 weeks beforehand. But again, it really depends on what the client's skin concern is, or you know, volume deficit, or it just depends on what we're doing. All treatments are pretty bespoke. They kind of need to be, because everyone's face is so different. And very asymmetric. People often don't know how asymmetric their faces are, until you point it out, and it's one of those things that once you see it, you can't unsee it. So yeah, I swear 90% of my job is just education. And you know, seeing what you can do and giving options, and then, you know, usually it's baby steps you do.
And I think education is just so important for the client. I don't think there is enough of that out there at the moment. So yeah, that's always really lovely to hear.
And it's very much an industry where people like to sell. And they like to sell because it benefits their hip pockets. And I would hate for someone to walk out of a treatment with me and feel pressured to anything. I'd rather you go home having nothing done and come back and say, I'm mentally prepared, this is what we're going to do, we're going to do it for X, Y and Z reason, because you've told me these are the risks, you know, and be in a good mindset to do something.
So you do consultations before someone comes in?
Yeah, absolutely. It depends on the person, and you know, I've had clients that I've had for years and years that have often referred other people to me. If that's the case, if people generally have no idea what they want, then they can just book in as a new client for that procedure. And if that's the case, then they'll get a little bit longer, and we can have a chat about what we're going to do first. If someone has no idea and they say, you know, I'm a blank canvas, what can we do? What are my options?
Do what you want.
Yeah, they're my favourite. Then yeah, I'd say book in a consult, and if you have a rough idea what you're going to do afterwards, then we can, you know, book you in for the appropriate thing. But it just depends. Yeah, right.
So can you tell us a little bit about what the difference is between Botox and filler?
Yeah, so Botox or Dysport or Zeman or any of the neuromodulators, they work on the muscle to actually relax the muscle as such. It's temporary. Depending on your dosing and where you're putting it and why you're doing it will depend on how long it lasts for and the aesthetic that you'll get from it. It pretty much just turns like the little muscle receptors in, turns like the little signals off in the muscles that, you know, would normally get the signal from the brain saying, hey, move for this indication. So you're just retraining those muscles to work in a different way, more or less. So
yeah, sure.
And then whereas Botox is a very small amount of liquid, filler is a gel-like substance where it occupies the space. Filler can be used for a few different indications, so it just depends on where you put the filler as to what it's going to do. So say if you're putting it deep on the bone, you're going to be lifting all the structures from the bone up. If you put it into the fat, if you pick the right filler, you can be mimicking fat.
Okay.
If you put it into the skin, you can use it for hydration. You can also use it for strengthening.
Okay.
So fillers are really versatile products. They're really great if they're used well properly, and if the appropriate filler is chosen. So
sure. So would you use perhaps like a different filler in the lips to what you would in, say, like the cheeks?
Absolutely.
Yeah. Okay.
And following on from that, say someone our age, to say like a 40-year-old, maybe 50-year-old, 60-year-old, you'd pick a different filler again. That's going to be suitable for like the skin laxity, tissue coverage, that type of thing. So there's so many different fillers out there, and you just need to have a good knowledge. I don't stock, I stock one particular range, but I have like kind of my core products that I know and I love. Yeah. And I have like 6 or 7 fillers that are my go-tos. Yeah. Very occasionally I'll cherry pick other brands, but I find once you've got your few fillers that you know, and you know, again, it's predictable. You know what you're getting. You know the result that you're going to get. Yeah. To an extent. Definitely. It's definitely about selection, and that'll play a huge part into your result.
So what can someone expect to kind of find immediately post-treatment to, say, a week down the track?
With filler or with Botox?
With both.
Okay, so Botox or any neuromodulator, well, actually, that's not necessarily the case. So Dysport kicks in quicker. For that reason, I don't know. Being that it's the same drug, I'm assuming maybe it's a concentration issue. But so Dysport, it's a couple of days. Botox generally takes a little bit longer to kick in, and I can't speak for Zeman because I've not used it. Yeah. But it can, all the products can take up to 14 days to totally kick in. So often, if someone's not happy with a treatment, which is unlikely, but if that's the case, you always wait till the 14-day mark to correct anything, because sometimes one side will kick in quicker than the other side, whereas fillers are fairly instantaneous. Often fillers will get better with time too. Yeah. Fillers are hydrophilic, so they love water. So that's one thing I always tell clients, that you need to drink lots of water, and fillers will they will swell and expand with time. And in saying that, some areas of the face, like you might wake up in the morning, you might be a little bit puffy because you've been lying down, and you don't have adequate lymphatic drainage when you're lying down. So you'll find during the day the fluids will move.
Yeah, okay.
But mostly with fillers, you'll get a pretty instantaneous result. Yeah. It just depends again what you're doing, why you're doing it. Some treatments, say like PRP or the biostimulators, you're waiting months to see results.
Oh wow.
Yeah. Oh, and even with needling, you know, 3 weeks down, like you'll be a little bit flaky, and you'll feel almost like a tightness, but you need to do subsequent treatments to really get a good result. But yeah, it's one of those things, if you think of how long it takes for skin cells to migrate from the bottom to the top, you're looking at least 28 days. So some treatments, anything where you're regenerating cells, it takes time.
Okay.
And it's definitely a long-term process as in comparison to, you know, a one-stop kind of fix-it-all appointment, which I try and discourage, because that's when you're going to end up with unhappy clients.
So
because
you
the
prefer
expectations
to
up here
underdo than overdo?
Absolutely. I'd rather people want more and come back, as opposed to completely fill someone's face. One, get a pretty poo aesthetic, and two, you know, you're overselling something that you can't really promise, if that makes sense. So I'd rather, and especially if someone's not ever had treatment too, I'm very much for baby steps, and I like to err on the side of caution. I'd rather you have more movement than you'd like, come back and we can pop a little bit more in, as opposed to having a frozen face or having, you know, too much filler and thinking like, oh, what have I done? So it's very much hand holding, and again, education. But
definitely. And I think I prefer to go under than to go over.
And most people do. Some people do like the overdone look, and that's the particular aesthetic that they like. Each to their own, that's totally fine, but I'm not the injector for you if that's the case. And I'm so happy saying that to people. Like, I'm not, you know, I'm not going to put my reputation on the line for your desire for duck lips. That's so fine. There's many clinics that will do that.
Oh,
it's
definitely.
Just won't be me.
Well, that's really, really good to know. So I think another thing that I hear a lot is, I don't want to get like a treatment like that done because I'm going to get bruising or headaches or this or that. Like, obviously those things can happen. Is there any way that someone can help reduce that?
Bruising in particular, drinking alcohol plays a big part in bruising. Bruising is a tough one. If you, there's a particular picture which shows all the vessels on the face, which I just wish it was aesthetically pleasing to have on the wall for all people to see, because people need to see. Like, there's so many little vessels, some of next to no consequence, but they're there. And if you hit them, they bruise. And it's not an issue, it's just people don't like to bruise, and you know, that I totally get. But in saying that, it's more common that you will bruise than you won't. I more or less say to people, expect to bruise. If you don't, fantastic, you know, bingo, that's a bonus point for you. But look, in medications, if you're taking blood thinners, even herbal things like fish oil or like anti-inflammatories, they also increase the risk of bruising. But some people just bruise, and the people that you just wouldn't expect to bruise either. So it's a really hard one to pick. But definitely alcohol, like, you know, aspirin, anything like that, just going to
err on the side of caution.
And look, and if you don't care, that's fine. Just buy a good concealer.
Definitely.
You know, like a little corrector palette.
With you know, getting your Botox done, I have heard a couple of people say that they do get headaches
post. It's interesting. I don't think anyone really knows why. There's a few theories, and one being that the Botox travels down a neural pathway maybe a little bit deeper than say it would in other areas of the face, or than it normally would. But it's a hard one. Generally, it goes away fairly quickly, but for those people, it's pretty uncomfortable. Whilst they have it, I personally have not experienced that, so I can't speak from experience. But it is temporary, and I guess you just have to weigh up the options. Do you want the Botox or?
You're never going to know going
It's pretty
into it.
uncommon. But it's not unheard of. Like I've had a few patients, and it's just one of those things.
So while we're on the topic of headaches, using Botox to help things like migraines, how does that sort of work?
So there's a thing called a migraine protocol. I personally don't do it because it's not cost effective for the client. You're better off going to a neurologist where you can claim it back on Medicare.
Okay.
Or at the very least a GP that knows what they're doing. But to err on the side of caution, go to a neurologist or someone that specialises in pain. Because you're using quite a bit of Botox.
Okay.
And so it's just like multiple small injections, and they start from the forehead and they go all the way back through the scalp.
Oh wow, okay.
And, into the trapezius, into the shoulders.
So you were there for a while.
It's lots of little injections, but I don't think it would take that long. Like,
sure.
You'd probably be there for like half an hour or something.
Yeah, wow.
Yeah, just lots of little ones.
Okay.
And I don't think it'd be any more painful than a normal Botox treatment.
Yeah.
But yeah, just in terms of being cost efficient, like I've heard great results.
Yeah.
And if you're someone that suffers from migraines, I'd definitely look into it if traditional methods aren't working. What I do see clients for are more tension headaches. So people that clench or grind their teeth.
Yeah.
I find a lot of people get tension headaches just from constant clenching. I being one of them, I love it. And it's not that my muscle's particularly big, and most people aren't. Yeah. Or if you're a gum chewer, that can make things, like you can have noticeable masseters. But yeah, people will often not notice that they're clenching. Yeah. Or if it's
I clench, so it's nice to know that you can get that done.
Yeah.
So it's just kind of put
just into this muscle here. So the treatment itself, I just get you to clench the muscle so I can actually feel. Yeah. Because there is a big vessel along there, so you need to know what you're doing. But yeah, just making sure that you're getting really into the belly of the muscle. And if it's quite a strong muscle, and if you are clenching or if you're grinding a lot, and you normally wear a guard or something like that, sometimes it can take a few sessions to really shrink and atrophy the muscle. But once you're there, then you can typically get about 6 months out of it. So
wow.
Yeah, there's lots of things. Like it's a pretty awesome drug, that one in particular. But yeah, it's just knowing what to do.
Yeah. Wow.
But once you start, you're like, oh, I could do this and I can do this.
I know. It's
like, there you go.
Going down a rabbit hole, isn't it?
Yes.
Could get everything done.
Yeah. Just fix me.
Yeah. So when you get your Botox or your filler or anything like that, I know that you should kind of avoid certain treatments kind of after, like facial, kind of pressing too hard, stuff like that. So what would you say to someone that you would recommend they steer clear of, and for how long?
So my normal spiel. Yeah. So upright for 4 hours. Okay. Just so you're not, again, pressing on any areas or moving the product into any muscles we've not treated. No facials, massages, anything where there's vigorous movement of the facial muscles for at the very least a couple of days. Yeah. If you're doing fillers and things like that, then I'd say at least a couple of weeks. You want to really give things, you want to give time for your treatment to settle. You've probably spent a pretty peppy on your face, so you don't really want to be messing with that, especially with fillers. Yeah. Botox, look, if you're doing, say, your frown or something, you don't have to be too careful as such. Still do all your normal things in terms of skincare, cleansing, that fun stuff.
I got told not to raise my eyebrows once. Don't raise your eyebrows for a couple of days. I was like, oh God.
I've heard, but then some people will tell you that their injector told them to raise their eyebrows. Yeah. So yeah, look, there's lots of weird and wonderful advice out there. It's going to make absolutely no difference if you use the muscle. Like I've specifically put the product in the muscle I want to treat. Yeah. Botox spreads on average about 1 centimeter from injection site, whereas Dysport is 3 centimeters.
Oh wow, okay.
Again, that comes down to concentration. Yeah. And as long as you dose correctly, it doesn't matter. You just it's just a slightly different injection technique. But yeah, you just no vigorous rubbing of the face, and you just be mindful. And you might get a little bruise here and there that might make you a little bit more aware that you've had something done. Yeah. But yeah, definitely do all your normal skincare. And no makeup for 24 hours if you can avoid it. Yeah. If you absolutely must, then use like a brand new mineral based makeup. Okay. So you wouldn't be using the same old dirty makeup brush. You'd be
because that's obviously open little.
Yeah. Oh look, the actual injection sites themselves, like they close within a matter of minutes. Okay. You just want to minimise the risk of infection. Sure. More so with fillers than Botox. I always put some Bepanthen which, you know, is an antiseptic nappy cream.
Yeah.
Just as an added kind of barrier.
Yeah.
But yeah, look, technically, yes, not for 24 hours, but say if you were going to have it today, you know, you'd get ready for work normally the next morning. So it's common sense, really.
So what are some common misconceptions you hear about either your profession or what you do?
Oh, that's a good question. I guess some people don't understand that you have to be a registered nurse to be an injector. I know there are some enrolled nurses, but they're under direct supervision of a registered nurse. So in my opinion, it's kind of like you're double handling.
Yeah.
But each their own. If that works in their clinic, then so be it. But you know, and that's not to say that everyone's experienced. That's definitely not the case. I know there's some beauticians that will go and do nursing purely just to inject.
Do that.
Which, you know, in my opinion is not awesome. I think you're better off having a good solid clinical background. Definitely. Or still, you know, have your foot in that door. But yeah, it's very much a learned art. I think everyone's really going to be a bit shitty to start off with.
Yeah.
You're going to have a droopy brow, or, you know, you're going to have some pretty unappealing lips. Yeah. Or, it's definitely something that's learned, and ideally you just need a good mentor.
Yeah.
But yeah, look, it's a tough industry to crack, to be honest. It's hard to get in without any experience, but then no one wants to give you the experience. They only want experienced injectors. So I can see why a lot of girls are going down the cheaper kind of mass-produced clinic route, because it is a foot in the door. But I find that there's not a lot of training, or there's not a lot of good training, reputable training. But yeah, look, there's some really great injectors out there. It's just a matter of doing your homework and looking at before and afters. And that's the hard part too, is that no one wants to consent to their photos being used, but they all want to look at the before and after. Yeah. So that's a really hard one too. Yeah. You know, you want to showcase that, you can do good work without making you look like, you know, a monkey or a duck, or, you know, all the other things that people associate with injectables. The idea is, you know, you don't know that you've had anything done. Yeah. If that's the case, it's been done well. Yeah. And it doesn't, you know, you don't have to go overboard. Like, yes, there are many, many, many great treatments, but you don't have to have every one of them, you know.
Well, how often would you recommend someone getting the treatments done?
Well, it really comes down to what you're doing and why you're doing it. For the average person that's just having a little sprinkle of Botox, it really just, again, depends on the look that you want. Yeah. If you're wanting to be quite frozen, if you're really wanting to like banish those particular lines, generally that's a younger face. You're looking, you know, 3 to 4 months. Okay. If you are someone that just wants a little bit, just want to soften, look a little bit more refreshed, then you're looking anywhere from like 4 to 6 months. Okay. And you know, you kind of have to work in with people's budgets too. Yeah. I try and make that not a priority for anyone. I'd rather do a good treatment as opposed to, but obviously you need to take that into consideration. Yeah. I'd rather do a really good treatment twice a year instead of doing 4 half treatments. Yeah. Purely because I don't think they'll ever be truly happy because they're not getting a proper treatment. Yeah. And if you underdose, it's not going to last as long. Sure. So you better, you know, that's my opinion, but yeah, each to their own. Some people, you do what you got to do. Yeah. So we're here at MADDYS Spa today, and you work out of here once a month at this stage. Yeah. Yeah, we will increase, but it's still a fairly new partnership between Lani and I. So yeah, it's beautiful. I love it here.
And what other clinics do you work out of?
So G&T Beauty in Mona Vale, and I work with a plastic surgeon buddy of mine in Sydney. But watch this space for Sydney. So yeah, I'm still on the lookout for that perfect place. Yeah, I think it's going to be a right fit for you and the person. Well, look, I think I've just been a little bit spoilt here, and my other Mona Vale clinic. They're just so beautiful, and like, yes, they do the fluffy beautician stuff, but I quite like that because it's complementary. Like, I really want clinics that really focus on skin, so that way I can come in and just, you know, it's just a little cherry on the cake. I guess I do some skin things, but like the majority of my work is injectables.
So do you do any of your skin treatments out of these places? Yeah, you do.
Yeah, but everything I do, they can't do to
that extent.
Yeah,
sure.
Yeah. So I don't want to step on anyone's toes.
No.
But yeah, I like to keep my repertoire of treatments to like medical grade treatments.
And in terms of taking on new clientele, are your books open?
Oh, absolutely. Yeah. So I was pretty booked out prior to going on maternity leave, but given the nature of the industry, it's something that people want it and they want it now.
Yeah.
So if you're not available, I took pretty close to a year off injecting.
Sure.
So, you know, people are loyal to an extent. They're like, oh, buggy you, I just want my Botox.
Yeah.
So, you know, some people have been loyal to the doctors that I've worked with and whatnot. So, yeah, no, still very much open. Here at Maddy, book out relatively quickly.
Yeah.
But yeah, it's good. It's been a good venture. So,
yeah. Is there anything else you would like to add into this at all?
No, I think we've covered everything.
Yeah?
Yeah.
Wonderful.
Yeah, it's been lovely chatting with you.
You too. So that's our little, I guess, series on Botox and injectables. We will always be taking more questions like I normally do. So if there's anything that you guys would like to know a bit more about, or, you know, you'd like to get in touch, I'll make sure I tag Maddy in this as well. And, you know, I would love for you guys to get in touch with her. Yeah, hopefully there's some potential new people out there that would love to come and see you. Thank you very much, and thank you very much.
Thanks for having me.
Hopefully there'll be another video to come.
I'm sure there will be. Lots of stuff to cover.
Yeah. Thank you. Bye.